Goni cervical rotation. Position the patient in sitting with the thoracic and lumbar spine well supported by the back of a chair. Position the cervical spine in 0 degrees of flexion, extension, and rotation. In patient-appropriate language, ask the patient to rotate the neck. Assess the shoulder girdle for rotation of the thoracic and lumbar spine. The patient may hold a tongue depressor between the front teeth for reference. Standing behind the patient, place your hands on either side of the patient's head above the ears. While watching the trunk for trunk rotation, turn the head with your hands. The end of cervical rotation range of motion occurs when resistance is felt and additional motion causes the trunk to rotate. Assess the infeel, which is firm because of tension of the alar ligament and the facet joint capsules, also because of the contralateral longus capitis, longus colli, and anterior scalene muscles. The ipsilateral sternocleidomastoid muscle may limit extremes of rotation. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you'll be using. Align the axis of the goniometer over the center of the cranial aspect of the head. Align the stationary arm parallel to an imaginary line between the two acromion processes. Align the movable arm with the tip of the nose. If a tongue depressor is used, align the goniometer parallel to the longitudinal axis of the tongue depressor. Ask the patient to perform cervical rotation as previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the head to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 60 degrees.